Hello everyone, I'm Dr. Darsh Shah.
And I'm Dr. Altamash Raja.
And welcome to Medicine Redefined,
a podcast where we will explore the often overlooked but necessary components of health, what we consider to be the fundamentals.
We will investigate topics and practices that can give you and your patients the best chance to optimize a healthy lifestyle. It's time to move the needle forward and put the health back in healthcare. It's not a secret that doctors have a hard time creating a professional-looking digital presence. Having a dynamic website, ranking in Google, or growing your volume of patient reviews are not easy tasks. We're too busy to figure it out on our own. Advice Media has been around for over 20 years and works with physicians to create a more brandable online image. Attract more patients, generate more calls and emails, enhance brand awareness, protect your online reputation. Schedule a demo with Advice Media and receive a $50 Amazon gift card just for chatting with them. 3 in 5 patients will choose one provider over another because of a strong online presence. If that's the case, what is your online presence saying about you? Don't delay booking your demo today. Go to drpodcastnetwork.com/advice media. That's drpodcastnetwork.com/advice media. All right, everybody, you are in for a treat today because our guest is no other than Dr. Beth Frates. Now, Dr. Beth Frates is an absolute pioneer in lifestyle medicine. She is an award-winning teacher at Harvard, and she currently works with patients to help them adopt and sustain healthy habits through her private practice called Wellness Synergy. Since 1996, Dr. Frates has been on the faculty of Harvard Medical School and has won multiple teaching awards for her work in many different preclinical core courses. She has also developed and taught a college lifestyle medicine curriculum at the Harvard Extension School, which is one of the most popular courses offered there, and was actually chosen to be a case study for 4 successful courses. Dr. Frates is also an accomplished author. She has a book that's actually in the list of 100 best medicine books of all time by BookAuthority, and that's called The Lifestyle Medicine Handbook: An Introduction to the Power of Healthy Habits. Now, throughout this episode, you're going to learn pretty much the core of lifestyle medicine, which is one of the tenets that me and Altamash heavily talk about with all of our guests. So you're going to get great insight into what lifestyle medicine is and how Dr. Frates has truly expanded this upcoming growing field and that is really permeating throughout a lot of medical institutions. You'll also be able to hear Dr. Frates tell her inspirational story that got her interested in medicine and eventually lifestyle medicine. Enjoy. All right, everyone, welcome back to another episode of Medicine Redefined. Altamash and I, super excited for this episode, joined by Dr. Beth Frates. Dr. Beth Frates, how are you doing today?
Wonderful. Thank you so much for having me. I've been looking forward to this conversation.
Oh, the pleasure's all ours. Thank you so much. So let's get right into it. Offline, we were just about to get into a lot. So we said, hey, let's hit the record button and let's get it going. So let's talk about your journey a little bit, right? From your childhood into where you are now. How did you get into physiatry?
Right. I didn't even know anyone in medicine growing up. My whole family was in business. My dad's dad, so my grandpa, started a financial advising accounting company. And then my dad and his brothers took it over. So my world was finance and business. I saw the pediatrician for routine visits, but that's it. I didn't know anything about medicine. And I did like science and I did like math a lot growing up, but it wasn't until I was in college and I was a freshman and I went to get my books at the Coop at Harvard in Harvard Square. I was so excited. I got them. And I wanted to call my parents and explain to them that I got my books and I'm so excited. I was an economics major and I wanted to tell my dad I was taking Ec 10 because the whole plan was that I would take over the company and be the 3rd generation. So I wanted to share my books. And so I called. I couldn't see it like it was yesterday, but it was many years ago now. I went to the payphone right outside the Coop and called my mom, and she answered and said, "Your dad loves you very much." And I thought that was very strange because I knew my dad loved me and I didn't understand why on earth my mom would be telling me this the very first moment that I called her. And then she proceeded to explain that dad was in the hospital with a heart attack and stroke and I needed to get to New York right away. Fortunately, my brother was also in college at the time and he had a car. He was at Boston University. So we arranged to have him pick me up at Harvard Square and drive me to the Valhalla Medical Center, where Dad looked to me like death. He was so pale, and I had never been in the hospital to visit someone until that time. He had what I know now, of course, as nasal prongs and IVs, but they just, at 18, looked like tubes coming out of every orifice that he had, and he could not move the left side of his body. So it was really tough. And I remember just walking in there, hugging him, and then crying, just crying. And then, of course, my dad was crying, my mom was crying, my brother's crying. Everybody is just crying in the room. And I do remember that Dr. Moses, who was our family doctor, so his dad's doctor is my doctor, everyone's doctor, and he came in and he saw us all distraught, and he brought us into another room, and he talked to us about what happened, and that why it happened, that he had a heart attack, and then part of his heart wasn't beating properly, and then he got a clot, and part of that clot went up to his brain, and that is what is impacting his inability to move his left side, but he can recover. And he gave us a great deal of hope. And he, in fact, was a sensitive and intuitive man and physician. And interestingly, he gave everyone a job. I don't remember my mom's job. I don't remember my brother's job. But my job was to help him with his hand, because Dr. Moses has seen this before, right? Heart attack and stroke. And we know that fine motor movement, the hand is awfully difficult to come back. And getting strength back in that hand is so important. So I was in charge of the ball. He showed me the ball, and I was to help Dad with the ball whenever I could and talk to him about the ball, because I was, of course, going back to college. So I remember feeling, okay, I have a job. So this gave me something to focus on, something tangible that I could do to help in this recovery. And I learned he could recover. We didn't know how much, but he could recover. I learned a little bit about why it happened, but not enough. And that experience with my dad led me to the library, Widener Library at Harvard, where I wanted to learn all about heart attacks and strokes, how they happen, why they happen, how do you prevent them? If you have one, will it happen again? In the beginning was all about protecting Dad and figuring out how Dad could recover and how Dad wouldn't have this happen again. And what ended up happening is that my dad and my mom went to intensive lifestyle medicine programs. I didn't know that at the time. Pritikin was one of them. Whitaker was one of them. And he and Mom traveled, spent about 2 weeks in these intensive lifestyle medicine programs where they learned. My mom accompanied him. They are very close, always tight, and knew that she wanted to change how she cooked. She wanted to change how they interacted, and she wanted to be right there for Dad. So that's what happened. Dad learned about exercise. He learned about a healthy diet. He learned about stress relief. And everything changed. And fortunately, he made a complete recovery except for fine motor movement in the left hand, such that he couldn't manipulate coins. But otherwise, you wouldn't know that he had had a heart attack and stroke. You would never know. So he really worked hard with PT, with OT. And I changed my whole career, and my interests went right into cardiology, really, the heart and stroke and preventing a stroke.
So that's super interesting that you say, your thought process went into cardiology, right? And at the age of 18, I can only imagine how tough that experience was for you, but also life altering in the sense that, instead of thinking about the family business, you're now thinking medical school and beyond. So you get into medical school. And you have this story of patient zero, as you so often call it, being your father as that first patient that you've really gotten to know. When you're in medical school, though, I can only imagine that you're not really getting taught this lifestyle medicine that your father went through. How did you still keep it on your radar when you're getting taught by academia nothing really about lifestyle medicine?
Right. May I bring you back to college for a moment, to my thesis?
Yeah, absolutely, please.
So I had this understanding. This was the 80s. I think this happened in 86. So I was studying in 87. And I wanted to understand everything about heart attack and stroke. And I understood my dad. He was a wonderful man, always loved him. He managed stress in different ways. Before the heart attack and stroke, it was a little more challenging. He could get angry, nothing out of the normal, yelling, but you could just tell he had hostility. And you may not be aware of this, but there was type A behavior, and research in the 80s was talking about a certain personality that's more prone to heart disease, a type A personality. And what it was the hostility factor that was the thing that was most risky for heart disease. I was really fascinated with stress and this idea that mental stress could have an impact on the heart. And at that time, Rosansky and colleagues had put forward and published a journal article in the New England Journal of Medicine about mental stress and the heart. And I thought it was fascinating because they showed that when someone goes through mental stress, and in this protocol, they did serial 7 subtractions from 100, that you could see EKG changes similar to those when someone is on the exercise bike for a stress test. So I brought this study to the local hospital, Valhalla Medical Center, and I went to the front desk, the information desk, and I said, "Hi, I'm a medical student. I want to be a doctor, and I'm a pre-med, and I want to do some studies similar to this one on stress and heart disease." I mean, I'm thinking about it and I'm not sure these things happen these days, but I did do that. And the woman, the receptionist, was very kind, and she said, "Well, there's Dr. K, who's a cardiologist. So I suggest you go meet with him." So I pranced myself up to the cardiology floor, found Dr. K's office, had my article in hand, and basically somehow got to meet him and told him my story about my dad and how I really want to look at this mental stress in the heart. And he said, "Terrific. Are you thinking you want to be a doctor?" I said, "Yes." He said, "Well, why don't you do rounds with me in the morning? We'll do research later. You can have a whole internship." So he actually created an internship for me over the summer. I got paid. And this is why cardiology was on my radar screen to begin, because I started working with him right away. Now, I do want to share with you that he was not a believer that mental stress would have such an impact on the heart. And he thought that if we replicated the study, we'd find something different. And I couldn't believe it because I knew that we were going to find the same thing. And I thought, okay, this could already be a bias. So I said, could we get a psychiatrist to work with us too? Because I kind of think it's a little bit psychiatry too, isn't it? I mean, we're talking about the brain and mental health and stress. So he said, "Oh yeah, sure. I have a colleague in psychiatry and you could rotate with him too if you want." Anyway, got a psychiatrist to work with us as well. We replicated the study. Of course, all I could do was be the stressor. They said, well, I mean, I was a medical student. I didn't have any training. So they had me go in and talk to the patient and say, okay, now we're going to do serial 7s, take 100, subtract 7 again. So I was meant to be the stressor. And when I first went in to do the study, I was like, "Hi, I'm Beth Peg, and we're going to do some mental stress now. So it's going to be, serial 7s." And suddenly I got in 3 sentences, and then they came marching into the room and they pulled me out and they said, "Stop. No, this is wrong. You are not doing this correctly. You can't do this, or you need to do it differently. You're a stressor. You don't go in there all bubbly and smiley and make them feel happy. You have to go in. You don't crack a smile. You say your words. You're very clear, and do not smile, and try to have them subtract serial sevens. And if they get it wrong, you say wrong. Do it again. Faster, faster. You're supposed to stress them. Anyway, awful. I had to do that. It was very stressful for me. I'm sure my heart was showing EKG changes too. It was just awful. In fact, one patient cried. People do not like serial sevens. I will tell you now, they don't like to do subtraction from 100 serial sevens.
I don't like to do serial sevens either, especially when I'm asking patients. So
I agree. We have to, I mean, as you already know, we have to do that as part of our neurological examination for stroke patients in the rehab unit. And nobody ever does. I usually just stop at 86. I'm like, you're good.
It's stressful. So at any rate, what we found was exactly what Rosansky and colleagues found. And that was fascinating. And I really admire Dr. K because he was my first mentor in medicine. And he was shocked and surprised. That was actually my thesis, the replication of that study. And I will tell you, this has everything to do with my career and the path, because he was the first person that really set the tone for me in medicine. And many people in the 80s that I met at that hospital said to me, don't do medicine. All the doctors were saying that to me. Don't go into medicine. You seem bright. Go into business. Medicine has changed. We can't do anything anymore. Insurance is tying us down. It's no longer fun. We're also not as well respected. You're at Harvard. You seem so bright, and you're a very hard worker. You should go into business. Your dad had the business, you said. You should take that over. People were steering me away from medicine. And I sat down with Dr. K and I talked to him about that. And he said, well, this is what I have to say. You have a good feeling around medicine. You understand quickly what's going on with the heart here with patients. I think medical school will not be hard for you. I think you can do it. And I say this, if you enjoy it and you can do it, get your MD degree and then do whatever you want with it. Guess what? Once you have that MD degree, you could be a journalist. He said these things to me back in the 80s. You could be a journalist. You could work for a company. You could run your own company. You could write books. You could, and he gave me a list of lots of things I could do. And I said, oh, right. Well, I do love it. And I love the material. So that's what got me in the path of comfort with this career or going towards medicine. And then when I got to Stanford, I went right to cardiology. That's what I knew. And many of us at Stanford, and I believe it's still the case now, we do research throughout medical school. The first preclinical years, we're heavily in the labs. When we get to the clinical years, we stop our research or start writing papers from it. But we get paid for our research work at Stanford in the preclinical years. So I did do that, and I went to Dr. John Cook in cardiology, who was studying the endothelium, and he was looking at how different diets impact the endothelium. This was animal research, and it was hard for me to do that, but I did, and it was bench work, obviously, and we were looking at the endothelial cells. We looked at cholesterol-rich diet versus nitric oxide-rich diets. So that was fascinating back in the early 90s. And the nitric oxide-rich diets, we found that the endothelium was healthier and there were less plaques, which we would have guessed. And it showed what you would think. And to this day, we see. I learned
Dr. Frates, for those who don't know, what would be an example of a nitric oxide-rich diet versus a cholesterol-rich diet?
Right. So walnuts typically have a great deal of nitric oxide. We consume them ourselves. So a mixture with walnuts would be what we used. And by the way, the endothelium is the lining in the blood vessels. So the endothelial cells are those cells that are in contact with the blood. And then you of course have your adventitia, you have tissue, you have cells, and then you have tissues that go around these cells and create your cylinder of your blood vessel, right? And the blood goes through it. So it's the endothelial cells that line it. And so you want healthy endothelial cells, because when those are damaged, then anything can leak out of the blood vessel, right? And into the adventitia and into the tissue, and then create inflammation, plaque, foam cells, part of the atheroma, the cholesterol plaque that we know. So I did enjoy the research, but I did learn at that time bench research wasn't where my heart was. And my heart was with the clinical, with the patients. Even though I was stressing the patients in my previous research and I didn't love that, I knew that if I were to go in academia, it would be clinical work, clinical research. So I was all set to continue on towards cardiology. And I did the research in the labs for 2 years. And then you start to get into clinicals. And I started to think, I better start learning about lifestyle for these physicians. Because remember my dad's story, I told you the medical side of it. The lifestyle side of it is that I saw my dad work to the bone. I saw him work 6 a.m. to 11 p.m. I saw him experience great amounts of stress. I saw him being disconnected from his family, although there was tons of love. But when he was in the house, he wasn't really present because he was thinking of 100 other things. He was going to work on the weekends. His diet was awful. He's a New Yorker that walked fast, talked fast, ate fast food. He ate sugar and candies and cupcakes and Oreos and all sorts of things that made him feel better and gave him that sugar high. And he didn't exercise at all. And I saw that life. I understood that life, and I didn't want that life. And I started to see physicians. You don't have to be in business to have this life. I started to see some physicians who had that life. Also, I had met my husband. Well, in college, I met a guy named Jim Frates, and we dated. And in medical school, we continued to date, and then we were engaged. And I knew we were getting married, and I really wanted to have children. And I also knew I loved children because I had been a babysitter, and that's how I made money in high school. And I wanted to understand what the lifestyle of a cardiologist was, and a woman in medicine, what does it mean? So I started to interview, just informally, I started to interview a lot of women physicians and attendings. And I, as if it were yesterday, I'm sitting in this room of a cardiologist who was lovely. I forget her name, and let's not mention it anyway, but she was lovely. This a wonderful person. She was brilliant. She had a lot of papers. I think at this point she was perhaps in her 40s, had kids, was already a associate professor, and really someone I admired. And so I listened to her career and I said, this is terrific. Look at her. She's done amazing work. And then I said, are you married? Do you have kids? And she told me, and I said, so how does that work with the kids? And she explained to me that she had a nanny, and she would see the kids on the weekends. And sometimes she would be called in on the weekends. And I started hearing a pattern that sounded an awful lot like my dad's pattern. And I started thinking, I don't know. I already know I have high cholesterol, and I could bring that down with diet, but I don't want to have all the other risk factors. I mean, I was running, I was exercising regularly, and I was trying to be stress resilient. But I thought this may not be the path for me. And then I was going to all sorts of career fairs and trying to meet women that were leading a life in academia. I wanted to be in academics. I love academics. I always love teaching. I love learning. I love reading. I love academics. So I knew I wanted to be in academics. So I went to these different career fairs at Stanford. And it wasn't until probably the end of third year, I went to a career fair. And I don't know who else was there. I mean, there was a GP, pediatrician, cardiologist, and some others, and a physiatrist, something I'd never heard of before. And again, I wish I could tell you her name. I cannot. It was a vibrant woman, probably, it's hard to say, right? 30s, 40s. She talked about caring for stroke patients. She talked about the musculoskeletal system. She talked about her own lifestyle, how she was biking, running races, road races. She had kids. She spoke about family weekends, and I gravitated to her. So after the whole panel, I spoke with her about physiatry, which I, again, never heard of before. You'd think I did. It was my dad had a heart attack and stroke, but no one mentioned the word physiatry to me, or if they did, I didn't remember. So then she started telling me about stroke patients, and I could do a rotation at Stanford in physiatry. So I signed up right away, and I did my physiatry rotation focused in on stroke with Dr. Jeff Terioka. I know that so well because he invited me back to do grand rounds at any rate. And I had an amazing time. I loved it. You could spend time with the patients. I could teach them about stroke prevention. I could teach them about their recovery. I got to meet the family. There were family meetings. It was a team meeting. You actually worked with other healthcare professionals, the physical therapist, the occupational therapist, the speech therapist. You met with the family. This was a whole different kind of medicine that I had never seen before. And working with the family really obviously touched me deeply, right? Because it's back to Dr. Moses. He was our GP, but he sat us down. You could do this. You could do this. I felt like I was Dr. Moses a lot of the time. I was having those family meetings and feeling like I was really making a difference. And then being able to help patients have hope. Part of me also wanted to be a psychiatrist, actually. But I didn't really gravitate towards schizophrenia, bipolar, a lot of the very important and interesting diagnoses that psychiatrists manage. So I felt when you were a physiatrist, you were doing some psychiatry. Of course, you needed a psychiatrist to help your patient when they had depression and anxiety and other problems, but you were giving hope, and you were helping a mental attitude. You were helping create the space for the patient to see that they had a way out of this mishap. They could actually even be better off. And this is what my dad would have told you if he could have. His life changed, and it was all for the better. The best years he had were the 27 years he had after his heart attack and stroke. So I was able to be that person that could help these stroke survivors specifically. But of course, I had spinal cord injury, traumatic brain injury, and a lot of other patients when I was rotating through physiatry and did my residency. But my heart was always focused on the stroke patients. And then the clincher was, I thought about my life with Jim and hopefully having children. You never know, but hopefully. And I knew, because there's a part of me that's a big kid and playful. And I knew that when I had my own kids, I was going to want to be doing cartwheels, running around with them, being on the playground, being down in their level and just loving it. And I knew from my dad, right? There's a short window of childhood and you can miss it. And I didn't want to miss it. So basically I thought, what's going to be the thing that will get me out of the house when I have my kids and keep me practicing and helping and healing stroke patients? That's it. I will always have a fondness, have a calling to help stroke patients for the rest of my life. I just knew it. So that's it. That was physiatry. It's physiatry and stroke patients, and it turned out to be the best decision I could have possibly made.
Dr. Frates, thank you so much for sharing that heartfelt and inspiring story. As Dar said earlier, we were also stoked for this interview because I have been following your work for quite some time, and I always wondered, how did you get to where you are today? And a couple of years ago, when I was pursuing physiatry, just like yourself, a lot of people told me it was the best kept secret, right? I don't think that's the case anymore, and I wondered how you got there because you're a few years ahead of us, and so I imagine that, like you said, it wasn't on the radar for a lot of people, and people didn't even know. And there's two questions every physiatrist needs to be able to answer. Well, question one: what is PM&R? Right? We have to explain that to people, and then the second one: why PM&R? And what I find is every time I have a conversation with somebody who's passionate about this field, like you are, it's a very personal journey. And so thank you for sharing yours with us. And you talked about physiatry and, of course, how lifestyle medicine came on your radar. So I'd love to know what your practice is like today. Are you doing more inpatient, outpatient? Are you doing lifestyle medicine? What are you doing today?
Right. I will tell you that I am not practicing physiatry anymore. I just do lifestyle medicine. So my work is academic lifestyle medicine, meaning, as you know, I do a lot of teaching and writing and curriculum development. And in fact, you mentioned earlier being board certified, and there's board certification in lifestyle medicine now. And I was one of those 4 item writers that wrote the exam. And I love that. I love that academic piece, the lifestyle medicine interest groups that I have here at Harvard and help to create throughout the country and now the world with American College of Lifestyle Medicine. So I do a lot of that work. And now where I am as the president-elect of American College of Lifestyle Medicine, doing a lot of presentations about lifestyle medicine. And then here I've been...
Congratulations, by the way.
Oh, thank you. That was exciting. So I've been at Harvard for a long time, since 1997. I'm doing a lot of CME courses here around healthy living, lifestyle medicine for leaders, health coaching. And then I do my own practice. So since 2009, I've had my own space, my own practice of lifestyle medicine and coaching. And that's one-on-one, and that's group coaching. And one additional piece of my work, which came much later, has been consulting. So I think Jenny Craig was the first company that brought me on to their scientific advisory board, perhaps 10 years ago. And this is a fun way to use my experience in health coaching and lifestyle medicine to help companies, help patients, empower patients to make lasting change. So that's my role there, is to work on the coaching pieces. And then Obvious Solutions, which is a wearable device that helps people to stay on track with their exercise, their diet, and especially their posture. They brought me on, and more recently, another company brought me on to do medical advisory work. And I love that. So that's my job. It's a lot of different hats, all of which I absolutely love. I think a missing piece of this journey is physiatry to lifestyle medicine, which happened in 2006. So after residency, I wrote a book about how to prevent a second stroke, realizing there was a gap. As a resident, I asked stroke patients, we all know I'm fascinated with and dedicated to the stroke population. It's been forever. And I asked the stroke patients, we had an IRB, and we asked stroke patients and caregivers, do you know what kind of stroke you had, infarct, hemorrhage, bleed, or clot? Do you know why? What were the risk factors? Do you know what you're doing to prevent the stroke? Do you know what medicines you're taking? 50% of patients after being in rehab, in my day, it was 4 weeks in rehab, a week maybe at Mass General in acute care. So 5 weeks. You've been with physicians, you've been with nurses, physical therapists, occupational therapists. All of us have been talking with the patient, right? Medical students, interns have been talking and teaching. And 50% of people didn't pick up these very important pieces of information. So I thought, okay, here's a huge gap. There are no books on this. We need a book. How do you prevent a second stroke? So when these people leave the hospital and leave rehab, they're going to get the information. They need this information. Otherwise, we're going back and having another stroke. What have we done as caregivers, as providers? We haven't done our job. Sure, we got them stable. They're up and going. And this is, of course, very important. But we must make sure that they don't have the same problem. So wrote that book. And to write that book, I co-authored it with attendings of mine that I was close to. One had written many books, and one was the head of stroke at Spalding. At any rate, I looked at exercise, nutrition, stress resiliency. We know I knew about stress, but I looked heavily into exercise. Not in terms of physical therapy and which muscles do you want to work to regain function, but what does aerobic activity do in terms of preventing the second stroke? So really heavy into that, and published that book, co-authored it. And I was at a meeting, an annual meeting of PM&R from Spalding, the Harvard department. And I was standing there, and so my fellow attending, some of whom, of course, have been there forever. So I was a resident and they were an attending, and they were saying, oh, proud of you and your work. And someone in particular was Eddie Phillips, and he was always an outpatient. I never rotated with him, but I knew who he was. And he said, Beth, congratulations on that book. You know what you're doing? You're doing lifestyle medicine. I said, really? What's that? He said, you're helping people through their lifestyles to prevent stroke. You did exercise, you did nutrition, I said, yeah, I did do those things. And I love those things. In fact, I love studying those things. I love doing it for myself, because guess what? I don't want a heart attack or a stroke. That's pretty clear. And so I want to practice this myself, and I want to help other people practice this too. He said, well, you know what? Why don't you come with me on this journey, and we'll start the Institute of Lifestyle Medicine at Harvard, and we'll create this thing. It's like, fantastic, let's do it. So this is like 2008, and we started the Institute of Lifestyle Medicine, which to this day is a great resource for CME. So every year at Harvard, we give 2 or 1, and sometimes we're on every other schedule, but CME courses on exercise, nutrition, sleep, and it's grown and grown. And I then got health coach training, because I'm really into and always wanted to help people sustain the change. So you write the book. I thought that was the answer. Well, people read the book, they forget. Some people need a little bit more. And so I took, I don't know, at this point, probably 4 or 5 health coach trainings, and a certificate in motivational interviewing, and really have practiced coaching since 2008 or 9, I think I was certified. I was one of the first physicians to really embrace this and become certified as a health coach, and then talk about it and teach health coaching and the coach approach at CME meetings. So in about 2009, when I got certified as a health coach, I realized that I'd be doing a lot of work outside the Harvard system. So this was a big choice, and it was a tough choice to go part-time, meaning I would start my own thing called Wellness Synergy, and then Harvard wouldn't own anything that I did or created in that space. If I stayed full-time, anything I did or created is owned by Harvard, because I did it on their time, which makes sense. So I separated myself back, 13 years ago. So at that point, I had my own thing going, and that has evolved with time. In the beginning, I was coaching patients mostly from my physiatry colleagues. They would give me people who had diabetes or obesity or post-stroke, and I would coach the patients. I still do some patient coaching. What's happened with time is now I am coaching leaders. So I am now the director of lifestyle medicine and wellness in the Department of Surgery at Mass General Hospital. So I'm working with the Department of Surgery, the surgeons themselves and the residents there, to help them be as productive as they can be, as healthy as they can be. And it's really been a challenge during COVID, but I've been happy to have all these different opportunities. I still do work with patients. Everyone's patient. Doctors are patients. I still work with a whole array of patients. It's primarily now been deans of the medical school, lawyers, CEOs, other physicians. It's evolved a little bit, and I've gotten into some also leadership coaching. What's interesting is, to be a good leader, you need to be healthy. You need to have a healthy body, a peaceful mind, and a joyful heart to really be a good leader. So that's what I've been doing, and that's what happened. That's a journey.
Wow. So like Dr. K was right on point, right? You get your MD and there's so many different things that you can do. You wrote a book, you're a health advisor here, you're health coaching, and I know there's a lot more out there too. So you mentioned some things that lifestyle medicine incorporates: exercise, stress management, nutrition. And when you were sharing your journey, there's something that struck out to me. You said you started out talking about your father's medical side of things, and then you kind of brought in the lifestyle side of things. But the lifestyle side of things happened before the stroke, right? It's where the work needs to be done. And so often students who want to go into medicine, when they think about being a doctor, they think about coming into the hospital or coming into the clinic and what happens after that. But we're here in lifestyle medicine trying to shift that focus and looking at preventative care, looking at before they enter the ER, before they enter that patient room. What are those things we can do? So let's delve into the 6 core focuses of lifestyle medicine. What are they?
Yeah. So it's funny because we've gone over the first 3 just briefly: exercise, nutrition, stress resiliency. And when we were doing the CMEs back in 2008, that's what we focused on, those 3. And with time, and actually from counseling patients over time, I noticed that when patients weren't sleeping, they were having a whole lot of trouble moving their bodies, exercising, and making decisions that were good for their bodies in terms of their meals and meal times. And this was becoming more and more evident, right? So then we're adding, sleep is a critical part of this process as well. So that's now 4. And then substance use. So alcohol and cigarettes, that's been on the radar for a long time, because if you look at Mockdad and colleagues' original article, really a landmark study in JAMA from 2002, they looked at actual causes of death. So we know diseases that are causing death: heart disease, cancer, COPD, stroke. We know diseases that are causing death. But what's fascinating about Mockdad and colleagues is they then looked at, wait, those are the diseases. What are the behaviors behind those diseases? What are the behaviors that are creating those diseases? And top of the list, tobacco. Second, physical inactivity and poor diet. They were lumped together. They were almost about the same as tobacco. And then, we got into a lot of different things, accidents. But those 3, tobacco, so substance use, physical activity, inactivity, and poor diet. So substance elimination, moderation has been on the lifestyle spectrum story for a long time. But we really started focusing in on it closer in the sort of 2012 range. ish, and then social connection around the same time, meaning the power of social support. It's not just it feels good to have a friend. That's true. It does. But what I love about lifestyle medicine, again, you remember I love to go to the library, I like to look at the research, I love to dive deeply. So I did that with social connection. When you dive deeply with social connection, you look at an article from 1979. Berkman and Syme published an article when they were evaluating subjects over the course of 9 years in Alameda County, men and women. They followed them for these 9 years. They put them in different age categories, 30 to 40, 40 to 50, 60 to 70. Put them all in different age categories, men and then women. Looked at what happened with them over the course of 9 years. Put them into categories of social connection. They had a social index, how connected they were with others. Those with the least connections, men and women in every single age group, those with the least connections were the ones most likely to die. So we knew back in 1979 that social connection was a really powerful force. Now, look, if you go back to the 1940s with Maslow's hierarchy of needs, so you have at the baseline, right, the foundation that we need, physiologic needs, food, water. After that, you need shelter. Not to protect yourself. There's animals. There's danger. You need a shelter. Then right next, after physiologic needs, shelter. Very next thing in the pyramid, social connection, belonging, sense of love and belonging. So we have known this for so long. And it used to be a pillar that was hard to sell on people, on physicians, on even patients. So what's going on with your social connection? I mean, you knew when it was broken. People who had divorce, people who were struggling in that way, in a relationship in that way. You knew that everyone would acknowledge, well, this is a hard time. Oh, this is tough. This is tough. But that's about it. But nowadays, and now with this pandemic, this pillar is going to no longer be one that is questioned. There's research, though. We can look at the research that shows before COVID that if you are not feeling socially connected, if you do not have a sense of belonging, if you are feeling isolated, you're more likely to have a heart attack. Your wound healing is less. You're more likely to have cancer. I mean, the signs were all there. And if you dug into the research, you saw it, you found it. But it wasn't really something that was addressed in clinic visits. Exercise got up there quickly. Nutrition got up there quickly. Of course, smoking and alcohol was always there. Even when I was in a medical school, that in the 90s, we were on that right away. Stress, it got in later, like in the 2000s. It was Herb Benson here at Harvard actually started the Benson Henry Institute, Mind Body Medicine. He really brought to the forefront the importance of stress reduction and resiliency. And he was coming to CMEs back. I went to his second CME in 2002. It was one of the first times we had such a CME, stress reduction, the importance of stress reduction. So what I love about lifestyle medicine is there's science behind every one of these. So for physical activity, accumulate 150 minutes of aerobic activity in the week. That didn't come from thin air. 8,600 approximately studies were evaluated in 2008 by exercise physiologists, scientists, physicians. United States Health and Human Services pulled these people together to evaluate thousands, 8,600 journal articles and come up with some guidelines. And that's when they created a graph that looked at how many hours of activity per week people were doing, and then looked at all-cause mortality and tried to come up with best recommendations. And as I tell you, 150 minutes. If you can do more, you do 300 minutes in the week. And then according to their research, what they found, there tends to be a plateau of benefits. So in lifestyle medicine, we're giving you the dose, we're giving you the science behind the dose, and then the secret sauce is how you counsel it. You can't just wag your finger at someone and say you need to exercise 150 minutes in the week, as if this is like a magic wand, this finger that's wagging around, and it's going to poof, suddenly they're going to be walking or running or biking or paddleboarding or whatever for their exercise. It doesn't happen like that. You have to connect with them. You have to go through a whole process of coaching them. So then nutrition, we focus a lot on a plant-based diet, plant predominant diet in lifestyle medicine. We focus a lot on vegetables. Why? The research is there. If you look at the research, even from 90s, 2000s, 2008, and it continues to this day, when you add servings of vegetable to patients, when they start eating vegetable, their risk for cardiac disease goes down. So you by adding vegetable to your diet, you're actually reducing your risk of having the heart attack, the number one killer. So we know this, research based. We're trying to get at least 3 vegetables, 2 fruits. At least, I personally am trying to get 8 fruits and vegetables every day. 8, 6 vegetables, 2 fruits each day. So, but the dose that we're looking at anyway is at least 3 vegetables. If you can get to 5, 7, terrific. But we know that when you add a serving of vegetable, you're going to reduce your risk of heart disease. So then you go to stress resiliency and talk about meditation. Again, what's the dose? It'd be great if everyone could do 20 minutes of meditation at least 5 days a week. But what research is showing us is some is better than none. If you can, and this is true with exercise too, some is better than none. Same with vegetables, some is better than none. If you could get people to deep breathe, meditate, do mindfulness-based stress reduction, 10, 20 minutes, that would be so powerful for them. And we know Sarah Lazar's work at Mass General Hospital, bring it back to the science. She looked at meditators versus non-meditators. Those that were meditators had increased gray matter in their prefrontal cortex. So their brain was different than those that were not meditating. So we know that is good for our brain, our body, reducing cortisol levels. And as I mentioned with social connection, okay, we don't have exact dose on that. We know that when you have lack of it and you're isolated, it's unhealthy. I don't know if you're familiar, but if you have the Lifestyle Medicine Handbook, after every chapter, we give a fit prescription. It was hard to do social connection, but you want to at least be connecting with another and in a level that's beyond, hey, how are you? 5 days a week. And now COVID teaches us what happens when we're not able to touch, hug, be with others. Drinking has gone up almost 60%. Stress has gone up. So we did our own little mini experiment with COVID. And then we know with alcohol and smoking, right? Smoking 0. We've got to work to stop that. With alcohol, if you look at what American Cancer Society recommends, 0 if you're worried about cancer, 0. American Heart Association says 0 to 1 for a woman, 0, max 2 for a man. If you don't drink now, don't start. Science-based. This was different when my dad had his heart attack. My dad had his heart attack in the 80s. He was not a drinker, thank God. And so that wasn't an issue for him, but they told him, start drinking a glass of wine a night. And he did. But he was a man of rigidity and he followed the rules. And so he had his 1 glass of wine and was fine. Nowadays, if someone has a heart attack and stroke, no one is going to say, start drinking a glass of wine a day. That's not what the recommendations are from the American Heart Association. Science-based. Science changes. We learn new things. So this is why I love lifestyle medicine. And those are a little bit of information on each pillar. Hopefully that was helpful.
It certainly was. Thank you for sharing that and explaining every single one of them. All these pillars are quite similar, if not outright the same as what I typically look at as the five pillars of health. The one that I don't talk too much about is social connection, and perhaps I should. I know it's important. Sometimes I just kind of categorize it into kind of distress tolerance or mindfulness, just because for the reasons that you mentioned, it's hard to prescribe. Like, how do you give frequency and intensity and timing and that kind of stuff? But it's all the more reason to pick up your book, right? But people will often ask me, should I focus on this versus that? Right? They'll learn about these pillars of health, and it can be overwhelming, right? In other words, like, they want to know what that keystone habit is, right? So, of course, appreciating the role of assessment, which we talk about often on this show, we know that one change might be different from person to person, right? It's going to be the lowest hanging fruit, move the needle the most. But we also live in a world where people want to know the top 3 tips, the 5 things that's going to get my life completely right, or all that stuff. So, taking a completely reductionist viewpoint on this, if someone comes to you and learns about these from you, the foundational components, and everything's at a disarray, where do you start? Like, which one of these, if there is one, do you tackle first? What's going to pay the most bang for your buck?
Yeah, it's a great question. And so I've been doing this a while, and I've seen a lot of patients, and I see disarray in a lot of areas when we meet. It's interesting and it's fascinating, actually, because when you're in lifestyle medicine, we know that if someone is overweight, changing their diet will have the most impact on their weight. We know that exercise is great for them. And as it turns out, exercise is great for the mind and the memory, the mood. So much. Exercise will help with so much, and especially weight maintenance. And then stress resiliency. The truth is, most people get off their healthy path because something happens. There's some stressful event. So helping people manage stress, giving them stress resiliency tools will set them on the sustained path to keep these habits going. So to your question, think of it this way. If an alcoholic, all this has happened to me, I'll give you 2 patient examples which will answer your question. So I was working with a woman, and she heard about me. My business is all word of mouth. People hear about me here in Boston, and well, now it's gone a little bit more virtual, but it's basically word of mouth because I walk with all my patients, and we walk and talk, and we walk for an hour. And this woman had heard about me, and she asked to meet with me. I said, sure. Well, what are your goals? She wants to eat more vegetables. That was her goal. She looked very healthy and energetic, and didn't appear to have any problems. But I said, sure, if you want to, we can definitely do that. I love to work on that. Terrific. So we met. I walked for an hour, and it seemed fine, but I had this vibe that we didn't get deep enough. But she shared a lot, and we had a plan for introducing eggplant and some other vegetables that she was going to get at the store, and we had it all set out with SMART goals. And the next time we met, she was late. I neglected to tell you, she was late the first session, about a half hour. That doesn't happen. People are generally very early and they're raring to go. She was again late a half hour. It's unusual. We went on the walk, and then suddenly we were just walking, and she said, what would you think if somebody was taking sleeping pills for 10 years? What would you make of that? Okay. So we went through sleeping pills can be useful in stressful times and maybe for a short period. Who is prescribing them? My GP. It happened to be her. She was asking for a friend that then turned out to be her. And then it went into a glass of wine. Oh, no, a bottle of wine a night. But everyone does that here. don't they? No. So what are we going to do about that? So for her, we weren't going to start with diet, although that's what we started with, because that's what she said. But in that case, you have to go to the alcohol pillar. So usually when there's an alcohol situation, that's the one that needs to be figured out first. But interestingly, when you have smoking, and I've had this, smoking and overweight and diabetes and obesity, sometimes they don't want to start with that most important pillar of stopping the smoking. They don't really want to do that. So what I've done in the past is say, okay, so you've told me about what's going on and you've told me you want to change a few things. What do you want to start with? This particular person I'm thinking about with the smoking said, I want to exercise. I want to get back to biking. I thought, oh, perfect, because you're going to be huffing and puffing and you are going to want to quit smoking so quickly. I didn't say that, of course. I said, sure. Let's think about it. Where's your bike? Well, I haven't been on the bike for years. I have to get it fixed. Okay, this week, why don't we think about getting the bike fixed? So 2 weeks later, he starts biking. It's like, you know what? I got to quit smoking. So it came with time. Then I'm thinking about the other patient I want to share with you with this question is a woman who is 74. By BMI, she would be obese, and she heard about me from a friend who had lost 25 pounds. I'm not a weight loss doctor, but people tend to be so focused on weight loss that they say, oh, you look great. Why do you look so great? You lost 25 pounds. What did you do? And they say, oh, I was with Dr. Frates and I lost all this weight. So people think of me as a weight loss person. I make it very clear, though, I am not. I am not trained in obesity medicine. I do not prescribe medicine for weight loss. I do lifestyle medicine. Anyway, she wanted exactly what he had. And I said, well, wait, I don't do that. I need to focus on what you have. So we did our walk, and she hadn't walked for more than 5 minutes, but we walked a full hour. She couldn't believe it. She wanted to keep going. She loved it. And she told me about her eating habits, which were exactly like my dad's before his heart attack and stroke. No joke. I mean, I couldn't believe it. I'm thinking, wow, you are having what? Or what? Girl Scout cookies? Whole sleeves at a time? You are okay. Okay. Well, McDonald's is easy, and Dunkin' Donuts, and the whole the diet. To me, that's where I would have wanted to start. I mean, I almost felt. I remember this. We stopped the walk, and I almost felt like saying, "Okay, so what are we going to do with those Girl Scout cookies? You told me you have 3 boxes, so let's just get rid of those. I'll take them off your hands." I literally wanted to do that, but you can't do that with coaching. So I instead said, all right, so, well, good news is this was fun and you liked the walking. Terrific. We'll meet again. What would you like to do in the next week? I want to walk. I want to walk every day. And I want to walk for an hour every day. This was so much fun. I'm going to walk. That's what I'm going to do this week. I'm going to work on walking. And I'm thinking, oh, because that's a little bit overdoing it. First of all, an hour. She had only walked like 5 minutes at max before meeting me. She wanted to do the exercise. Fine. I'm not going to, for this to work, you got to follow their interests. So I didn't say, great, let's do an hour a day. Instead, I just was taking the coach approach, and I said, all right, well, an hour a day. Wow, well, that's quite a bit. So let's look at your schedule. So tomorrow, for example, when would you walk for an hour? And she said, oh, tomorrow. No. Tomorrow I have work, and then my cousin comes, and I'm going to actually make dinner for her. So no, I can't walk tomorrow. Okay. So when's the next day you could walk? Well, let's see. Well, the weekend, no, I'm going to New Hampshire. I'm going to visit my girlfriends, and I'm not going to have time to walk with them. So-and-so has a bad leg and they don't walk. Okay. And anyway, she walked 2 days that week for a half hour and was pleased. Now, it wasn't until really week 3 or 4 that she then started to address the food. So it's not the answer you want, but the answer to your question is, it really depends on the patient. But I did give you this. If you're looking for weight loss, diet is the first thing. If you really want to change your weight, looking at what you're eating and changing what you put in your system, which you're going to do 3 times or more a day, is a great way to go. I happen to love Exercise. Always have, even as a child, before all this even started. I played field hockey and lacrosse, played in college. I mean, I love athletics. So I am all for exercise and starting exercise whenever and however anyone can. I also love yoga and meditation, so I would love to get someone into that. But I don't use my own bias. I can't. I've been doing this too long. It won't work. You have to work with the person in front of you and figure out where are they going to put the energy.
Mm-hmm. Yeah, absolutely. I mean, yeah, I think you just nailed it, right? The way medicine is moving is towards this personalized approach. And I think patients are starting to turn into consumers, right? And they're starting to advocate more for themselves. And the thing that I love about the stories and the examples you just brought up is I really think the success boils down to the provider that they found, right? The fact that you do lifestyle medicine, that's the first step. And so as we talk about incorporating lifestyle medicine, into the healthcare system, how do we get patients, one, to care more about their own lifestyle, think about it more, but also find the proper providers to give that advice? But then also on the flip side, how do we get more healthcare providers to seek and learn and preach and to teach about lifestyle medicine to their patients?
Yeah, so those are a couple of really good questions. So American College of Lifestyle Medicine does have a listing of providers, so you could go there, and that would help, and that would help patients. What we're trying to do is get lifestyle medicine into medical schools at American College of Lifestyle Medicine. We started with lifestyle medicine interest groups. There are 40 official ones and 80 waiting to get in to the system. So it's going to get into the medical schools, hopefully into the core curriculum soon. So if you get it into the core curriculum, then every physician hopefully would be able to at least counsel on exercise, sleep, nutrition. Now, if they needed intensive lifestyle medicine intervention like Whitaker and the programs my dad did, that there are still intensive programs here and others are doing it, John Kelly and others around the country, then you need more time, and you'd need a physician who's board certified in lifestyle medicine, who's going to be able to wean off the current medications, right, and monitor the patient as they move towards this healthier way of living. So the first step is, in my mind, and why I wrote this book and co-authored this in the first place, was I actually want college students and pre-meds and people who are going to be lawyers, people who are going to be teachers, people who are going to be engineers, to know the basics and the foundation of lifestyle medicine for themselves, so they have some ownership of it, so they know the basic guidelines. And in fact, I don't know if you know this, but I really wanted to bring it a level even earlier to teens. When they're starting to make their own choices, they're going to head off to college. And I was hoping, and still am pursuing with American College of Lifestyle Medicine, that we can teach teenagers about these pillars, these 6 pillars, teach them so that they know this. All right. Giving some ownership to the patient is key, but with the physicians, you find one certified through American College of Lifestyle Medicine. How do we get physicians to want to do this, to get interested in it, to learn about it? Well, CME is a great way, because we all need CME. You guys haven't needed to apply or reapply for your license, but every 2 years you have to prove, right, that you have taken 100 hours of CME. So an incentive is to go to the CME courses and to learn information that may even help you. So we do active lives. So active lives. Doctors are active, patients are active. Back in my residency, you won't be surprised to know I did a survey study with some colleagues, a couple attendings, and other co-residents, and we asked family physicians, do you exercise? Do you do aerobic training? Do you do strength training? Then we asked them, do you counsel on exercise? Do you counsel on aerobic training? Do you counsel on strength training? And we found back in 2000 and reported in the literature that physicians who exercise counsel on it. Specifically, if you don't strength train, you don't counsel on it. If you strength train, you counsel on it. So how do you get physicians to get interested in this and to counsel their patients on it? Well, one way, and especially since COVID, and you guys probably haven't seen the transition in physicians as your residents and your career here has been a little shorter, say, than mine, but there's been a rise in burnout. And so helping physicians to lead healthy lives themselves, teaching them for themselves how to reduce burnout, how to increase joy in medicine, teaching them about the data around exercise and depression and anxiety, teaching them the data around vegetables and healthy diets for themselves helps. And we know that if they're doing it themselves, they're more likely to counsel on it. So that's another way, and especially with COVID, that is one way this is one benefit that might come out of this, which is we focus a little bit more on self-care and a little bit more on what we can do to keep ourselves healthy. Does that answer your question?
Absolutely. Yeah. And, what you're talking about is modeling behavior, right? The physicians have to take care of themselves first, and they have to exercise, they have to eat right, and you're doing the lives. And it's a perfect example of a case study, actually, even one step forward, and one of our first guests ever, Dr. Simone Mabin, who's also a health coach, much like yourself, as she says, you have to walk the talk. Right. And if you're not going to train, you're not going to exercise, or if you go see a physician, and there are some exceptions, but the physician's completely out of weight and is not eating right and telling you that, or smoking in the parking lot, and then you've seen that person and now you come into the office and they're like, hey, stop smoking. That message isn't going to get across as well. But, we talked a little bit offline about some of the challenges of incorporating this into the healthcare system. I love the fact that you're trying to build this into the medical curriculum, teach it earlier on, so it's part of that core component, and even earlier than that. One of the issues, as I'm early in my career and I've had these conversations when I'm looking for what my future practice may look like, is oftentimes it's about the bottom line, right? It's the bottom line that ends the dollar signs. So reimbursements and insurance is a huge part, at least in our healthcare system. How can we help? Because that's a challenge that I think a lot of lifestyle practitioners have, who are practicing at an institution and, perhaps not practicing in a private practice setting, or maybe in academia. How can we help remodel that? And what are you optimistic about in terms of reimbursements and for practitioners to be able to do this and from a practical standpoint?
Yeah, well, fortunately, we do have Dean Ornish and people who have been pioneers in this field for many, many years. In fact, I followed Dean Ornish after my dad's heart attack and stroke, and he's done so much research and is able to put forward a program which is reimbursed through insurance, the Undo It program, which we can all get trained in and do. So there are models where you can be reimbursed for your lifestyle medicine practice. And you can code for cardiac disease, obesity, diabetes. You can get some counseling reimbursement. What's happening now is group visits are being used, and you can actually see a large number of patients. You can do great work. It increases social connection because the patients are together. And there are some billing codes that you can use if you pull the patients aside and there's a bit of a visit associated with the group visit. And then you can bill for that. And we are working at the American College of Lifestyle Medicine to get in front of DC, Washington, DC, the politicians, try to get policy change, try to get more reimbursement for this type of work, prevention, treatment, and reversal. So preventing chronic disease, treating it, and reversing it in some cases. You know that if we work with diabetics, we change their diet, their activity level, their sleep, we can get them off their medications, not type 1 diabetes, but type 2. So trying to get in front of policymakers so that we can make these changes with the reimbursement. Now, first comes all the research. Dean and others have done a great deal of research. So we have compelling evidence. We have to keep showing insurance companies the evidence. I'm definitely optimistic. I think things will change, especially with COVID and the necessity to address people's sleep, their diet, their exercise. I think we will see movement in the future. Hopefully, by the time you guys are out and practicing. In the meantime, people are being creative and they're doing what they can. For me, it's out of the box, and it's basically concierge medicine. A lot of practitioners are doing concierge medicine, meaning, I'm not taking insurance. And that's one way to go. Of course, what I don't like about that, and what a lot of people don't like about that, is that means that if you can't afford it, you don't get it. So that's not right. So we can't stop there, and we're not. But at the moment, that's one way to do it. Now, other friends of mine are volunteering their time at clinics, and they're helping people in underserved populations to appreciate, enjoy, embrace lifestyle medicine for free. And at this point, they're volunteering their time. Now both of these are on the opposite side of the spectrum, right? We're making it free, or it's expensive. So that's why we want it to become part of mainstream medicine, so everybody gets this type of care. And I think in the future we will get there. And for example, even the intensive lifestyle medicine programs, right? My dad and mom could go there. Well, they could pay to travel, they could pay to stay, they could. So that's not really ideal for a community, a country, globally. We want these things available to everyone. That's going to take time, hopefully, with insurance and changes in insurance and policies. We'll get more and more reimbursement for lifestyle medicine. It's exciting. And I think if we have this podcast again in a year or two, we will see progress.
I'm definitely looking forward to that. And thank you so much for answering that question. You're actually answering a lot of my questions before I even ask them. And that's what I'm enjoying the most about this conversation. I struggled with that concept that you mentioned. A lot of people who are practicing lifestyle medicine, because we don't have the appropriate codes, and they're doing concierge medicine. And to me, again, it didn't feel right in my gut that, hey, because again, I mentioned I work in, a lot of times I see patients in inner city Baltimore, they can't even afford care with insurance. Like, they can't even afford their copay. They can't afford to pick up the medication, which might be a $5 copay. It's going to be very challenging to convince that patient to come see me for a 30-minute visit. And so I love what ACLM's doing. I love everything you're doing. And I kind of had this conversation with myself recently is, I can continue doing this. I'm not really sure why I need to be board certified in lifestyle medicine. But for all the reasons that you've talked about in the last hour or so, about doing this on a global scale, about being an advocate, which you have been for a long time now, and helping push the field forward. If individuals such as yourself, but Darsh and I, and trainees, and if we don't help and build towards the research, do actual studies like we do in other fields like PM&R, sports medicine, then insurance companies not going to be incentivized to pay for it, and it's going to make our jobs even more challenging. And so if most of us go into medicine because we want to be healers, right? We don't go in for financial reasons. It's a terrible financial decision. And if we truly care about that, then we kind of owe it to just our community and everybody to kind of do it from that perspective. I want to go back to something that you mentioned, this concept of burnout, right? There's a lot more awareness for it today in medicine, a lot of other professions too, but for the sake of our discussion today, let's keep it with medicine. we know that there are various reasons for that, right? High volume patients, EMR, less reimbursements, lack of control, et cetera, et cetera. And less physicians today are inspiring the younger generation to go into medicine. You said that back in the 80s. I had a very similar experience that, I would say maybe 90% of the docs that I shadowed said, don't do it. Just don't do it. And yet, I imagine you faced many of the challenges that I just talked about that all these other docs did. Yet somehow you've continued to model this optimism and inspire people. How have you managed to do that?
Well, thank you for saying that and that I am doing that. I hope I'm doing that. I think that you look for small wins all the time. Yes, there's a big win, which is that we'll get reimbursed for our lifestyle medicine practice and everything that we do. We keep looking for small wins. I just keep looking for small wins and get happy and enthusiastic when I get a small win somewhere. I also think that having a vision of your future, of the future of lifestyle medicine, and continuing to work towards that and knowing your motivation. So if you have intrinsic motivation, right? So motivation is coming from within you, not outside, not mom told me to be a doctor, or dad told me to be a doctor, or somebody told me lifestyle medicine is important. No, it'd be something like my dad had a heart attack and stroke. I lived through it. I want to spend my life helping people to prevent heart attack and stroke. I don't know how I'm going to do it. I don't. This is me as a college student and a medical student. I don't know exactly what I'm going to be doing, but I'm going to do that. I'm going to live my life so that when I meet people, when I engage with people, when I counsel people, when I am seeing a patient, I'm going to make sure that I can give them, again, just a little win, something that they can do that will help them be healthier and enjoy life a little bit more in the moment. And I think it's these little wins for patients that you want to give. And when I get a little win with a patient and a patient makes a little change and they come back and they feel better, that also energizes me. So little wins for the patient, little win for me in my practice. Yeah, constantly looking for the little wins. More importantly, going back to, well, why do I want to do this? And again, what is your purpose? What is your passion in medicine? And things then open up for you. You create opportunities. Opportunities come to you around this. For example, I felt I really want to help people that can't afford these programs. At Spalding, I do group visits, and the group visits are $20 for anyone to join. And sometimes that's too much. So fortunately, there was Same You organization. It's a not for profit, and they said, "Hey, we'll fund 5 of these for people who can't afford it. So we'll pay you, Beth, to do it, but everybody can come for free." So terrific. That happened during COVID, and I could work with people. That was the very first time I did these virtual groups. I never practiced virtually. I did one Skype patient before COVID, and that was kicking and screaming. It was for a friend. I just didn't believe that we could have a real powerful connection like I was used to when the patient was by my side. But I learned happily that you can have a really, really strong connection over the internet online. And these groups were powerful. And I got to meet people from Africa that joined. It was incredible. And this is one good thing that has come of COVID, which is that we now have this opportunity and we have solidified the platform and multiple platforms that can create social connection, bonding, patients to patient, physician to patient in a really powerful way. And if you have faith and you just keep doing your job and working really hard, and you also have your feelers out, and you're open-minded, and you're feeling creative, and you're ready to take a risk, then maybe a funder will come to you. It's always nice when a funder comes and provide an opportunity for you to do exactly what you were hoping to do. Give this free of charge to people who can't afford it, people who are, as you say, could have trouble putting food on the table. So I think, though, that real answer to your question, how do I personally stay optimistic? It's my Greek grandma, Rose, who came to this country when she was 18 with arranged marriage with my grandpa, and they had a restaurant, a Greek restaurant here in East Boston, a section of Boston that would be considered socioeconomically disadvantaged. And they worked really hard, and they loved their job, their family, and she taught me to be grateful for really the sun shining. I can see her now. Obviously, she's passed away, but she's all of about 5 feet, 90 pounds. And I can just see her. Elizabeth, the sun! Look at the sun! Oh, Elizabeth, let's have a peach. Ooh, the juicy peach. You know, she just taught me that there is so much to be grateful for in the world. And no matter what's happening, awful things are happening. You know, awful things do happen. And awful things happen to her. Awful things happen to her, meaning they made a lot of money, and they had their restaurant and a lot of money. I mean, what their goal was to send their 4 children to college, and they would pay for it, and they could do that. And that was their goal coming to the US. And they did it, and they were proud, and they made enough to own a building. And then they owned a building in East Boston. Oh, wow. This was terrific for them. And then my uncle, he was a lawyer and also interested in karate. He was also interested in ancient history in Greece, and he took some kids to Greece. I don't know if you've been to Greece, but the roads are very, very curvy. They don't have any guardrails. So he was with the karate kids that he took on this trip. The parents paid, and it was a whole experience. And unfortunately, his brakes didn't work properly, and he went off the cliff. And he was okay, and 3 of the children were okay, and the other was a spinal cord injury patient from that moment on. And this was a long time ago. Of course, there was a lawsuit, and they lost everything. So she then became poor, and anything that my uncle made went to the family. They could keep their house. At any rate, the story is I was probably like 10 or 11 when that happened, and my grandfather had already passed away of a heart attack. So the oldest uncle was in charge. That's how it worked with the Greek family, and he had everything in his name. That's why everything was completely lost. But you know what? She was Grandma Rose, still smiley and happy, still making her orzo and a kularakia and loving you and hugging you, and the garlic was still everywhere. she was still happy. She's happy because, you know, you needed the love of your family, and you needed food, and you walked around and you made a peach tree, and you just small wins goes back to just a small win every day.
Yeah. I love that perspective. When it comes to gratitude, waking up every morning, right? And small wins, especially when you're trying to change a system, right, for the better with that vision, but also changing yourself and developing yourself and having that growth mindset. And so, Dr. Frates, you've been a pioneer at the age of 18, right? Starting research early, already having this vision in terms of, well, what else, you know, can I find out? And you're still a pioneer. What would the Dr. Frates of today tell that 18-year-old Dr. Frates?
Yeah, this is an interesting concept. I've seen it a bit. Notes to younger me, thoughts. What would you say to yourself? That's a great question, because I've not answered this question ever before in a podcast. I've been on a couple podcasts before, and I haven't had that question yet. You know what? I think Dr. K said it. I think he said, if you love something, keep going on with it, and just be open to opportunity. Follow your passion. If you love medicine, if you love lifestyle medicine, so now there wasn't such a thing then, but if you love lifestyle medicine, follow that and be open and willing to take risks and see how you do. I didn't know the term growth mindset, but have a growth mindset. And if you have a mishap, just learn and grow and move on. Just learn and grow from any mistakes. So be willing to take risks. I think I would say that, which really is a lot of what Dr. K said to me.
Yeah, I love that. And, speaking of following your passion, our hope is that some medical students, residents, physicians earlier in their training, or really anybody, will listen to this and say, hey, I'm passionate about everything Dr. Frates shared with us. And, maybe the concept of motivational interviewing and being a guide with their patients on their journey to health is something they're interested in. Darsh and I are big readers. We love to read, and we're always trading books and stuff. And I suspect you are as well, having that you've written a couple of books. Are there any books that you would recommend to your students, to your trainees, aside from ACLM and the Harvard Institute of Lifestyle Medicine, for that specific thing exactly, for motivational interviewing, for just kind of the coaching concept? Any things that you recommend?
Yes. So I'm just laughing. So there is the Lifestyle Medicine Handbook.
Mm-hmm. Of course, that's number one. That's number one.
Just so you know, and everybody listening understands, I don't get any proceeds, and I put it that way specifically. Any proceeds go to American College of Lifestyle Medicine, so I'm actually not just trying to sell this book, the Handbook of Lifestyle Medicine. I don't receive any funds for it, but I do think it is a good place to start. And there's 2 chapters on coaching and the coach approach. Miller and Rolnick's Motivational Interviewing for Healthcare Providers is fantastic. I love that book. I like very much Carol Dweck's book called called Mindsets. It's all about the growth mindset. It's called Mindsets, though. And another book I would say, there's Coactive Coaching if you're specifically looking at coaching. There's also The Psychology of Coaching. Those are all good books to get into the mindset of the coach approach versus the expert approach and the finger wag.
Awesome. Yeah. So my book list just keeps getting larger and larger after every episode, but this is great. This is what I live for, is just constant knowledge, constant learning. Dr. Frates, this has been an awesome conversation so far. Obviously, our listeners are going to want more of you. Where is the best place that they can find you, reach out to you?
I would say I have a website, www.bethfratesmd.com. The only social media I really do is Twitter, which is at Beth Frates MD. I'm also on LinkedIn, Beth Frates MD. So those would be ways.
And your Twitter's fun. You're posting pictures every day. Are those pictures that you're taking like currently, like in the moment?
So some of them are photos that I take currently, or my husband will take, or a friend will take, or I have 2 boys that are 21 and 19, my sons, and they will take. Sometimes they're often the videographers, and then others are from the internet, just photos that are common use.
Sure.
So they're not always what I'm seeing in the moment. And some are from the summer some are from the winter. So it's not always what's in front of me in that moment.
Yeah, well, I absolutely love your Twitter, and I just want to let everyone know to check it out because you really are building a social connection through that. So thank you.
You're welcome.
Absolutely. And in fact, that's kind of how we quote unquote met, right? Virtually, if you will, is because of everything that you were doing there. So Dr. Frates, you've got, you've done awesome things thus far, but you've got another big year coming up. So I'm always excited to learn about, what our guests are passionate about. So what are some future goals for you, both short-term, long-term? What are you excited about in the near future?
I'm really excited about getting lifestyle medicine into medical schools and working really hard with ACLM and their medical education committee to see what we can do and make movement there. I have a passion for those lifestyle medicine interest groups. I started one at Harvard in 2008, and they're really growing strong. And there's now an award for medical students that can apply for funding, and they can start a lifestyle medicine interest group, get $500. They can go to the annual meeting and then use that money for their activities. I'm really passionate about that and seeing that evolve. And most recently, I have this opportunity to be a co-editor for a nutrition textbook specifically for medical school. So that is something that will take a little while. And I am very excited to work on that project. Another book I'm doing with Dr. Rippey is on coaching, and that will be released in January 2022. I'm the editor of that one. I'm writing a couple of the chapters, but I've brought in colleagues to write some of those chapters for this behavior change book. So that will be a great book for you in your future in
Awesome.
2022. And then for me, I just finished culinary psychology course at the extension school. That's a new course that I put together with a therapist from Oxford in England and a chef from UCB, which is a college in the United Kingdom. And we're doing this at the Harvard Extension School. Our last class is actually tomorrow. We're going to have a panel of chefs. And what we've been doing with this culinary psychology course is looking at how to cook healthy meals, what happens when we're eating food, what happens with our brain. And then I'm bringing in the lifestyle medicine piece of, well, how do we encourage people to eat healthy foods? How does sleep affect our food choices? How does exercise affect our food choices? How about stress? And so that class has been a great journey. It's only version 1. So exciting for me this year will be to create version 2, get the feedback, and how will we make this culinary psychology course even more exciting and efficient, productive, educational, and engaging for the students. That's another thing.
Wow. I absolutely love that, because, Dr. K definitely wasn't kidding. A lot of times individuals who are going into the field of medicine, they kind of look at it as the end of the line, right? I'll do medical school, I'll do residency, and this is it. That's it for me. But for you, it was a jumping off point. And I want to thank you so much for all you've done, for being a pioneer, for writing books, starting practice, for exuding this constant positivity and openness on social media, which made me comfortable enough to just message you and invite you here. You talked about modeling behavior today, and clearly you're doing an exceptional job at that. And so thank you for everything you'll continue to do for the field of lifestyle medicine, for just medicine in general. And you've also mentioned today that it's about little wins and stacking little wins. And so this opportunity to, again, quote unquote, meet you and have this conversation with you, I consider that to be a big win. So thank you for your time. I appreciate it.
Oh, thank you so very much. I really enjoyed it. I do hope your listeners have learned something and perhaps been inspired. It'd be great to get feedback if possible.
Yeah, absolutely. And Dr. Frates, I just want to thank you as well. From the moment you came on, you were just talking from the soul. And I felt so comfortable speaking to you. And I know Altamash and I are just super honored to have you on here. We do ask one last question to all our guests. We just actually spent an hour and a half talking about it. So if you just want to sum it up in a sentence or two, but how do we put the health back in healthcare?
That's something that I think about a lot. And I'm not sure I have a one
Sure.
sentence answer. I would love to go for another. Do you have another hour and a half or?
We'll have to do a part 2. Absolutely.
So I may be biased here, but I do believe that a focus on lifestyle, getting lifestyle medicine into the medical schools, into every practice of medicine, so that people can understand what little wins they need in order to get the big win of health and optimal wellness is the best thing I can see to do. And it is surely what I'll focus on from here on in, and have been for, I guess, my career, that very thing.
Sure thing. That is well put. Awesome. Well, thank you so much, Dr. Frates. Again, it's been a pleasure.
Thank you.
Thank you.
Wow. Well, I truly hope that you all enjoyed that episode as much as me and Altamash did. Dr. Frates, it's just such an honor to have her as someone that we look up to join us and share her emotion and insight into this upcoming field. You know, Altamash and I have been following lifestyle medicine for a couple years now, and it's something that we're both truly passionate and interested in. So it was just awesome to have the president of lifestyle medicine come on and share her insight. Real quick, I want to give my co-host Altamash a big shout out for graduating from PM&R residency and, you know, going on to doing bigger and better things now with sports medicine. And, you know, a lot of the things that we talked about in this podcast with the lifestyle medicine, those tenets, those core values, I know Altamash is really about. So can't wait to see what he does as he continues to learn and keep going with his education. One last thing before we go, remember Advice Media? Don't forget to schedule a demo with them to receive a $50 gift card and strategic insight on what your current online presence is doing or not doing for you. Contact Advice Media at drpodcastnetwork.com/Advice Media. Again, that's drpodcastnetwork.com/Advice Media. And now time for that quick disclaimer. Everything in this podcast is for educational purposes only. It does not constitute the practice of medicine, and we are not providing medical advice. No physician-patient relationship is formed, and anything discussed in this podcast does not represent the views of our employers. We recommend that you seek the guidance of your personal physician regarding any specific health-related issues. Everyone, if you're listening to this, most likely that you are very interested in lifestyle medicine, functional medicine, integrative medicine, and just evidence-based medicine in terms of how we can all optimize our lives. And so we are coming at you every Monday with a new episode. Don't forget to rate, review, share, subscribe. Take care, everyone.